What are some of the other considerations that providers should have when they're working with patients with endometriosis?
I almost feel like it's so tricky to admit, but I almost feel like gaslighting and not having your pain taken seriously is just almost like a rite of passage for somebody with endometriosis. Something to be really sensitive to is that, this patient of yours that you're maybe working with who shared with you that they have endometriosis has probably been through the ringer, right? They've probably seen multiple specialists. They've probably been given the same two options, birth control or some kind of, hormone therapy. With endometriosis, very rarely do you actually look the way you feel, right? Like as we're having this conversation, I'm actually having some pain myself, right? And you would never know, thinking that, this person looks completely healthy, they're smiling, they're super enthusiastic, they have a lot of energy. You don't always look the way you feel. And we just get very, very tired of having to communicate that. And it's really hard. For example, in my marriage with my husband, like I still feel so much guilt around asking him to do something when I'm not feeling well, because even though I know that I'm not feeling well, it doesn't match up with the way that I'm looking necessarily, right? It's just frustrating because you wish that you could take somebody and kind of show them what's happening on the inside of your body and what you're feeling like. And you just really want to be believed.
Well, and how you learn to cope with it and like carry a brave face and kind of move on because it's something that you've always dealt with, right? So it's like you could be miserable 24/7 or you can figure out how to live life with endometriosis. But I totally get what you're saying that that brave face that you put on is not always reflective of what's going on inside.